Okay, so the thing to remember here when we're doing a cVEMP test is when the patient has their right ear plugged up, we're going to be measuring from the right sternocleidomastoid muscle, but when the patient is doing the action for this test, we're going to have them lift their head first and turn the opposite direction. So they're going to turn to the left and hold. If it's a younger patient, a lot of times they can do this independently, but our older patients sometimes need a little extra support, so you can kind of support their head a little bit. Once we've run 60 to 100 sweeps, I have them return to center and back down. And so again, we will lift, turn, they're hearing the stimulus, it's being recorded from the electrode here, and we're seeing all of that on the computer. And again, 60 to 100 sweeps, and then we return back to center. It's important to return back to center because a lot of times the patients will just put their head straight down, already turned, and then the next response won't be quite as clean. So then if we're doing it for the left side, say the left ear is plugged up, so we're gonna measure from the left ear, the left electrode here, and so when we lift, we're gonna turn to the right. So the turn is the opposite direction. Again, I don't have her plugged up here, but if we had the left ear plugged in, we would be putting the stimulus here, measuring from here, and this just gets the muscle contracted really well when we turn the opposite direction. So again, that's why we're turning to the right when we're measuring on the left side, because that activates that muscle response there. And again, you'll return back to center before you do the next test.